You are in the right place at the right time. And I hasten to tell you, with the right caliber of people, people who take a keen interest in your wellness, in your lifestyle, in your longevity, in your health. Welcome, it's Weekend Deal, the Nigerian Television Authority of the NTA. Yesterday, we opened up our conversation on cancer. So Francis continues with our conversation, and it brings us this overview.
For Nigeria and Africa in general, cancer is becoming most common and more deadly with over 200,000 cases per year. Worldwide, cancer deaths are more than the percentage of deaths caused by HIV/AIDS, tuberculosis and malaria put together. It is the second leading cause of death in developed countries and is among the third leading cause of death for adults in developing countries.
There are foundations that are working very hard, there are NGOs that are working very hard. But we are still very, very far away from where we need to be. A country like Nigeria, with the kind of resources we have, people should no longer die of breast cancer. There are countries that are not as blessed as we are, who have put everything in place to make sure that women don't die anymore of breast cancers, and that people who are diagnosed even of other forms of cancers have a good chance of living fulfilling lives and long lives. So we need more diagnostic centers. We need more treatment centers. We need science that is not yet available in Nigeria. For example, I have been doing my evaluation 10 years down the line, and I got a CT scan. And the CT scan, was not 100% conclusive, but they are questioning certain things that they have seen in the images. And what they are recommending is that I do a PET scan to, address whatever gaps there are so that we are very sure if there is need to panic or not. And then I start to make calls to colleagues around the country, and there is nowhere in Nigeria I can get a PET scan. Now that is scandalous. Look at all the hotels we are building, all the filling stations we have, all the shopping plazas, and other kind of investment that we are making. But we are not making health as much a priority in the investments that we have.
There are more than 100 types of cancer usually named for the organs or tissue where the cancers form. While some symptoms may differ between various people, it is important to get medications as soon as you notice the symptoms. The reason for the growth in cancer rates in Nigeria and the extremely poor countries are varied, which include unhealthy lifestyle and environmental pollution, late diagnosis, and poor access to health care.
The number one thing is to make sure that we improve our health-seeking behavior generally. There are people since when they were born, they've never really taken themselves to a healthcare center to say, please check me head to toe and let's address whatever you find. We seem to have superstitious beliefs that restrain us from being proactive. Those need to be addressed. The fact that I went to check to see whether I'm free of disease does not mean I am praying to have a disease. Our lifestyle. We just eat anyhow. We don't eat right. Plenty carbohydrates, very little vegetable, plenty of oil, and we seem to have become a dumping ground of all manner of seasonings. You enter the market, there is seasoning for pepper soup chicken, pepper soup goat, pepper soup cow. They all have different seasonings. You are doing a jollof seasoning. You are doing fried rice seasonings. You are doing cow leg, seasonings of all manner of things. And we don't even take time to ask, what is the content of this seasoning? Is it the kind of thing that will cause radicals to multiply in my body, thereby increasing my risk of coming down with a disease like cancer? There are many things with colorings. I don't know anywhere else people consume concentrates. Those are packaged juices, like Nigeria. If you go to parties, they are always on the table. Like one person is entitled to a malt, a Coca-Cola, a Five Alive, and they just put a whole bunch of those sugar things on the table for us. We need to begin to mind what we put in our mouths.
The psychological effect of having cancer can be devastating, and perhaps the key issue is that most people simply cannot afford the high cost of cancer treatment, be it radiotherapy, chemotherapy, immunotherapy, or surgery.
And government needs to begin to sit at table with activists in the area of health so that they are better informed about what the priorities are. And it is not eye service, and it is not tokenism. We want to sit at the table with policymakers as partners in progress, in development. We want more centers, we want centers in rural areas, we want the treatment facilities to be decentralized so that it can go closer to people. We need that to happen, and we need a budget for those who can't afford care, because treating cancer is not a joke.
Today on Weekend D, our focus will be on cancer and all you need to know about cancer.
It is very gladdening to talk with and listen to survivors because cancer and its treatment can be quite financially devastating and debilitating. What we must all strive to do, the best we can do, present ourselves for checkup regularly, watch how we live. Your lifestyle is who you are and what you will grow to become. Ore has spent time looking at not just the challenges for cancer manageability, but what the centers that treat cancer in Abuja face.
Nigeria's population of about 170 million requires at least 170 cancer centers, with 1 million people to a center, according to the World Health Organization. But there are a few cancer centers scattered around the country, which brings to worry the condition of Nigeria's scarcity of facilities available for the treatment and management of cancer. Nigeria has limited oncology facilities and radiotherapy treatment centers with fewer than 9 functional radiotherapy machines. 90% of these centers are not functional and operate without treatment planning systems. Only one center, the National Hospital Abuja, can boast of a treatment planning system and a cancer treatment simulator.
According to World Health Organization, at least 1 million people should be attached to a center, a functional cancer center. So Nigeria, with a population of about 200 million, we should be having like 200 centers of cancer. And we are now battling with 8, and 2 are the functional ones. We have one at Lagos University Teaching Hospital, Idiaraba. We have another one in University College Hospital, Ibadan. We have another one at Ismail Danfodio Teaching Hospital, Sokoto. We have another Ahmadu Bello University, Zaria. Another one in University Teaching Hospital, Benin. And then another one in Gombe. And then we have University of Nigeria, Nsukka. So for a place like Jos, they only have chemotherapy. And the major treatment are radiotherapy, surgery, chemotherapy, and targeted treatment. 3 centers will not be functioning at the same time. So majorly, we have 2 centers. The one in Benin, federal government are talking about replacing it with brachytherapy, where you can now fix some radioactive substance in the body, and then occasionally you now subject them. I think National Hospital is about the best cancer treatment center we can have in this country with the Lagos University Teaching Hospital. A linear accelerator was donated to them by the government and then NNPC subsidiary, which has now improved their rate of treatment, their treatment rate, and then their service efficacy. So right now they have a good radiotherapy, and most of the time they are functioning, but they are like being overwhelmed by a number of patients that are coming.
On July 18th, 2009, a fundraiser took place in Abuja to actualize the grand dream of Hajia Turai Yaradua, the wife of one of Nigeria's former presidents, to bring cancer treatment and facilities within the reach of the average Nigerian by launching the multi-billion naira International Cancer Center along the Umaru Musa Yaradua Expressway. Apart from the imposing structure along the express, the project is now virtually abandoned.
It was a private project which was being undertaken by the wife of the president then. But immediately the husband died, it becomes very difficult. I think resources and other things needs to complement for that center to be viable. So many other forces that will be acting on the ground and players to make sure that it didn't see the light of the day. If not, it would have helped a lot as a national center, which could help a lot of Nigerians and others from this mortality rate we're having in cancer. Now in this country, there is no cancer agency in the country. Cancer has no budget line. In fact, treatment for cancer does not have, it's not covered by the NHIS, the National Health Insurance Scheme. So people need to pay from their pocket. Ideally, before now, treatment and consultation fee of cancer used to be 1,000 for consultation fee and about 200,000 for a whole package of treatment. Now you cannot access it less than 800,000. In 2017, a legislative bill was passed on Cancer Research Institute and then treatment for this country, signed by our President Muhammad Buhari. But up till now, 3 years down the line, this has not been gazetted. And even there is no budget line for it, so it's like being useless. There needs to be an increased political commitment. Because even the centers that are functioning, a lot of private collaboration needs to even come in. We need to have a national cancer agency. Right now, it's only a desk in Federal Ministry of Health that houses cancer. At least each of the states, if we cannot even do more, let each state have a functional cancer treatment center. At least it will do us good. And then instituted with facilities that are updated and enough manpower. I think it will go a long way in doing this. Already we have a bill which can augment and make our national center to become functional.
The current state of cancer treatment in Nigeria might look dreadful, with large and significant deficiencies in facilities and treatment. But Nigeria has made and is in the process of making more steps in bridging these gaps through direct government intervention and private sector collaboration.
Thank you very much, Uririnsa, from NTA Abuja. That was in-depth and incisive. And of course, it continues to throw more light on our conversation, talking about cancer, manageability, funding, available cancer centers, and more. You do know that Weekend Deal is an interactive program, and we expect your contribution, just like yesterday, so that we can continue to know what you're thinking, how you feel, and what's happening in your area. We're talking about issues of cancer management, and we have a guest here. He knows a lot about cancer, especially in Nigeria. And we're talking with Dr. Adamu Al-Hassan Umar. He's the president of the Nigeria Cancer Society. Thank you for making the time to be here with us.
It's a pleasure to be here. Thank you.
I can and I will. Since February 4th, that phrase has become familiar for many Nigerians, and indeed, people all over the world. Is a theme for to mark the Cancer Day, or indeed the Cancer Week for this year. What does that really encompass?
Well, good morning, viewers, and thank you very much once again for having me. I am and I will is actually the real theme for this year's World Cancer Day activities. The theme is a global driven impact campaign that started way back in 2019. So it's actually a 3-year theme,
Okay.
just for emphasis and for a very robust approach at bringing all stakeholders on board. It is an initiative of the Union for International Cancer Control, UICC, to which the Nigerian Cancer Society is a member. And it is all about bringing people, bringing stakeholders on board. I am and I will. All our actions matter when we come together. It is an indication that everyone, not only those of us in the cancer space, every single individual is important and is a major stakeholder in the fight against cancer. And that is the reason why this year, being the last year of the I am and I will theme, is very significant for us because it is where we now take stock, where we now look back and see the successes that we recorded over the past 3 years.
Are there
And
any?
a lot of them. And we look at how best to improve, how best to keep on doing what we know how to do best. And like I said all the time, to us in the cancer space, every day is World Cancer Day.
Why do you say that?
Well, because every day on daily basis, people are being diagnosed of cancer. On daily basis, people are dying or with cancer-related ailments.
But is it fair to say that more people are dying than those that are surviving?
Well, you see, that is the problem when we have weak health infrastructure. And when you look at the statistics, it is quite alarming actually, because globally, on daily basis, you have over 52,000 new cases of cancers diagnosed. 52,000, over that figure actually. And you have over 27,000 cancer-related deaths on daily basis. When you do the maths over the 365 days of the year, you will definitely discover that the statistics is quite alarming. In Nigeria here, we have over 300 cases of cancers diagnosed on daily basis. And mind you,
and there are many that are not diagnosed.
And mind you, out of every one of these over 300 cases, there are hundreds out there that have not accessed care, that have not presented to the hospital, that have not been diagnosed. And that is the alarming statistics. When you look at the mortality rate in Nigeria, on daily basis, we have over 200 cancer-related deaths.
And that's the one that is recorded.
When you juxtapose the statistics of cancer cases that are recorded on daily basis and the number of deaths, over 300, over 200 dying on daily basis, it goes to show you that we truly have a long way to go.
Okay, but before we, yes, we have a long way to go, but happily, we're having this synergy. There's more information out there via the media. Many Nigerians, even the very comfortable and wealthy, may find it very debilitating to pay out of pocket for cancer treatment. So when we are aware of that, it now behoves us to provide a soft landing in terms of cancer treatment centers and policies that will factor in the treatment to reduce the financial burden of Nigerians. Where are we with that?
Well, thank you very much. A very excellent question. And sincerely speaking, healthcare financing generally is a kind of law in Nigeria, particularly as it regards to cancer management. And that is the reason why we in the Nigerian Cancer Society, and in fact all advocates in the cancer space, are calling for universal health coverage, a situation whereby cancers will be covered holistically by the National Health Insurance Scheme. If you read the press conference issued by the Honorable Minister of Health, Dr. Osage Hanere, on World Cancer Day, he made a promise that there are good intentions for all forms of cancers to be covered under the National Health Insurance Scheme. And in fact, it is instructive also to note that a bill has been passed at the National Assembly, I think by the Senate, and is waiting for concurrence at the House of Representatives and before onward delivery to the presidency for assent, where universal health coverage is made mandatory for all Nigerians, because that is the only way we will have a headway in fighting cancer. Because when you have a cancer victim in a family, it's not only that victim that suffers. Everybody in the family suffers because of the financial burden. Because you all have to come together to contribute to the care. And of course, the cost of cytotoxics. These cancer drugs are very expensive. The lack of facilities again makes it more difficult for patients to access care. So of course, we will continue to advocate, we will continue to talk to government, we will continue to encourage more funding for healthcare, and with particular reference to cancers in our own case.
Can we talk about the mindset? Does the mindset of the individual and perhaps the caregivers, the family, does it have any impact on the outcome?
Well, of course, when you have cancer, when a person has cancer, all he needs is actually the support of everybody. Particularly, that is the reason why we have palliation at the other end of the spectrum of care. Palliative care is very, very important.
Is that like hospice care?
Just like the chemotherapy, the radiotherapy, and all that. At the end of it, you need psychological support, you need financial support, you need to be supported so that you can survive. I'm very happy listening to stories from yesterday and of course this morning from some of the survivors. There was one particular one that almost moved me to tears yesterday. Her name, I think, is Chioma. Yes, and watching Dorothy Nuhu yesterday to this morning, an excellent woman. The issues she raised are quite germane. And these are people that we all need to support, because these are people that truly need us. Assuming a woman having radical mastectomy in both breasts, and you know how women are so fond of their body. And you discover that this woman may truly need everybody in the society to show her love, to show her support, so that she can have a positive attitude, so that life will be good for her. Mm-hmm. What we do is we try as much as we can to prevent people from having cancers. That is the reason why in medicine we say prevention is better than cure. And and then we try also to limit or to have fewer people dying from cancers. And for those that have it, we want to ensure that they have a better quality of life.
Yes. After they have survived.
Exactly.
But tell us about the quality of life. Like yesterday, Chioma talked about surviving from stage 4. Yeah. Is that a common occurrence?
That actually was a miracle. And what made it a miracle in my own view is the fact that she said she was diagnosed in Nigeria. And that's excellent. That's very good to know. But you see, the problem we have in Nigeria is that the elites are the ones getting access to care. The 3 golden A's are very important. Access, affordability, and availability. When you go to the rural areas, you don't commonly see these sophisticated health facilities, that can take care of cases. That is the reason why we have late presentation. And in fact, non-presentation in a lot of cases, because when you go to the local areas, when you go to the localities, you discover that people will tell you that if you have cancer, like in my localities, they call it JG. They refer to it as JG. Because in a lot of cases, what people think as JG is not actually JG. You will have a case of necrotizing fasciitis, that is purely infectious, but people will say this is cancer. And
because of lack of information?
Yes, because of lack of awareness. They stop person from going to the hospital until when it is very late. It has transformed into
another
something
thing that we should promote, doctor, is a health-seeking behavior.
Exactly.
We should promote that. Exactly. It's not a setback, or there's no scar on you if you say, I'm going to see my doctor. You don't have to wait until you have a debilitating challenge. But perhaps we'll talk more about that. But first, we go to Benin. There's much talk about cancer management.
In recent times, advances in medical research and science has made treatment and management of cancer more accessible and effective.
Treatment entails surgery, radiotherapy, chemotherapy, as well as other types we call them targeted therapies.
Our management has set up an oncology unit where cases of oncology from all units across the hospital are admitted there. And we also have pharmacy oncologists, we have nurses oncologists, we have doctor oncologists who work on that ward, and they take care primarily of oncological cases.
On the other hand, scanty data on cancer incidences and infrastructural challenges continue to be an obstacle in Nigeria.
Cancer treatment is not cheap. And not only isn't it cheap, it is not even readily available in our society in Nigeria. What do I mean? For example, the radiation therapy aspect. We have very few machines in Nigeria that are functional at this time.
How is Edo State faring in the management and treatment of cancer?
Benin Radiotherapy Center, the only functional radiotherapy center in the whole of southern part of Nigeria, and currently we have a brachytherapy machine used for mainly gynecological malignancies.
How widespread is cancer in Edo, and how are patients coping with the treatment options available in the state?
Hematological cancers, for where I belong, tend to make up about 5 to 10% of the general cancer group within our society.
The treatment is expensive. I was spending over 100,000 every chemo, and I did 6 rounds before the radio. It was really, really expensive.
It is unfortunate that when a patient has to go through breast cancer, or any type of cancer for that matter, they also have to go through the trauma of seeking where they would find treatment. This is not to mention how much the treatment costs. It costs a lot. And there are many people who are indigent and are unable to afford this treatment.
For most frontliners, 70% of cancer patients present relatively with advanced stage of the disease, a burden and challenge that remains a concern for medical centers in the management of cancer.
You have to go for screening, go for pap smear for cervical cancers, mammogram for patients for breast cancers, PSC checking annually for patients, male patients who are above 40-45. In this way, we are able to actually get the cancers at very early stage.
Mortality is high because people are ignorant of this disease. People are not properly educated about the disease. Many women are not aware of their bodies. Many women do not understand that they need to do a self-breast examination at least once every month, between 3 to 5 days after their period. It is so important.
Experts insist that early screening, a good lifestyle, and increased awareness, among other factors, remains the only panacea for the disease.
That was David Chos from Benin talking about cancer management. When we work together, we profess solutions that can have the greatest impact on us as a people. Before the break, we're talking with Dr. Al Hassan, and he's been throwing more light on what's been happening and how we can take better care of ourselves. And I mentioned health-seeking behavior of Nigerians. Where are we with that? Well, before you answer that, someone asked here, please ask the doctor how we can prevent cancerous diseases in general.
Well, sincerely speaking, talking about health-seeking behavior of Nigerians, it is very, very terrible, and it is very, very disappointing to see how people, in fact, these days, almost everything has carcinogens. Because when you go out there, you see them ripening fruits, you see them burning tires, trying to fry meat and what have you. And these are toxic substances that are truly injurious, not only to those around the place where the smoke is, but to those that will consume. And that is the main reason why truly as Nigerians, we need to change our attitude. We need to truly have a societal reorientation, towards a better and more realistic health-seeking behavior.
That's interesting. Prevention
is better than cure, like I earlier said. 1/3 of cancers, most cancers, are preventable. Another 1/3 is treatable. That means it can be cured if detected early. That makes about 60% of most cancers. So it has goes to show that when you create the necessary awareness at the grassroots level, when you create the necessary environment where people can access care, where people can have proper screening of cancers and then appropriately treated, you will go a long way in preventing most of the diseases that eventually progresses to cancer.
Okay, Chu and Daji, people refer to Daji like cancer in the north, and sometimes there's self-treatment.
Yeah.
Does it have any health implications?
Oh, definitely. Earlier I mentioned Jeji. Jeji and Chu and Daji are basically the same perception. It's actually a very serious misconception. It's a myth to a lot. And we look at it as a very negative way of making people not to come to the hospital early. Because when you don't come to the hospital early, definitely your cancer will grow. Like we said, at the initial stages, most of these cancers are actually at precancerous stages. They can be easily detected
benign
and be easily managed. Like in the case of breast cancer, they usually start maybe with lumps. Like the stage 1 of breast cancer is actually painless. I mean, the precancerous stage is actually painless. So if you don't come for regular screening, you can't get access. And of course, when they say this is JG, what they are implying is that it requires traditional medication. They give person a lot of concoctions. They give them a lot of herbs.
Does that work? Does it ever work?
The problem is, there is no moderation. There is no regulation. And that is the reason why we are working very hard. There is a new department now at the Ministry of Health, Traditional Complementary Alternative Medical Department, and it's a very robust department. And this is where you now have very good collaborative approach where you can manage or get across to the local populace, because most of these things people are taking back at the localities are not actually regulated, they are not actually moderated.
True.
And of course,
so sometimes what is meant to be good can have a negative impact. Activities to mark World Cancer Day.
Yeah. Well, actually, the week has been very eventful. In fact, starting from Monday, it has been busy all week. We were at the National Assembly on Monday, where about 5 health-related bills were considered. 2 of them, the Nigerian Cancer Society considered to be critical, where we can make an input. And in fact, I'm happy to say that the Senate Committee on Health gave the necessary recognition to the Nigerian Cancer Society to make an input during the public hearing that held on Monday. And these are bills that are aimed at increasing funding for healthcare in general in Nigeria, and of course to us with particular reference to the cancer. And along this, the course of the week, a lot of our colleagues have had several interviews, and the whole nation, like I told you, every day is World Cancer Day to us. October last year has been a Cancer Awareness Month, and from that October, it has been the whole year will be activities.
You have not relented.
In January, the whole of January is Cervical Cancer Month, and activities held across the federation, starting Borno State, Kebbi State, Niger, Ondo, all around. And the activities of this marking this year's World Cancer Day has gone across the federation. Partners, big NGOs, small NGOs, everybody, individuals, there has been a lot of activities, cervical cancer screening.
But tell me about this cap. Does it have any symbolic representation?
Well, actually,
and you're wearing one.
Yes. This is a crown. This is actually the logo of the Nigerian Cancer Society.
Really?
Yes, of course. And
are you saying we should eat more seafood?
Sorry?
Are you asking us to eat more seafood?
The crab is the symbol. Is the symbol of the society. So this is the logo of the Nigerian Cancer Society. And you can see the map of Nigeria because Nigerian is there in the name. And of course, the red and blue. The red is actually the symbolic color of the Nigerian Cancer Society.
Oh, wow. Yeah. We wish you well.
Thank you very much.
Adamu Al-Hassan Omar.
Thank you very much.
It's been very enlightening hearing from you today. We wish you well in all your endeavors because your success is ours.
I quite
Continue to work hard and we wish you all the very best.
Thank you very much. Thank you very much for having me.
More enlightenment will help us make better health decisions. You're watching Weekend Deal. We'll take a break. It was very enlightening to hear that cancers can be as varied as the different body parts. As in, if you can think about it, it can be cancerous. So it tells us that we must upgrade our health-seeking behaviors and patterns. Talking about the skin, they say that good health, just like poor health, starts from the inside and then comes to show or shine on the outside. Skin cancer, you heard about it. How does it present? Magdalene put this together for us. Statistics show that there are 4 major types of skin cancers: the basal cell carcinoma, the squamous cells, the melanoma, and the non-melanoma skin cancer. Between 2018 and 2020, skin cancers on the African continent rose by 20%.
Cancer is an abnormal growth of cells, and it can affect all the organs, different organs of the body, including the hair. The normal skin cell grew abnormally, grew out of control, and form a mass of cells. The common skin cancer is a squamous cell carcinoma. The melanoma is seen commonly in albino because there is a melanocyte which produces melanin that they are lacking in their system. So once they are exposed to ultraviolet radiation, they are bound to have melanoma.
It is true that we all desire great, superb, and glowing skin. But we must be extremely careful about how we maintain our skin.
Under normal circumstances, when somebody is sick, you will not be hearing too much odor. But a sick person who has bleached, who has been using a chemical creams, the next thing you will see is you'll be perceiving is a nerve smell because of the overusage of chemicals on the skin.
Within us, Nigerians and Africa, sometimes negligence and all that, we just believe it can only caused by sun, and it is not always sun. Especially those that work in the hot sun and work in a site, they can also have skin cancer based on the mixture of the cement. The cement itself has a chemical that affects the skin.
Use palm kernel oil for your skin, and also eat right, eat fruits, eat vegetables. You can't glow outside if your inside is dirty. And exercise regularly. Drink lots of water.
I consult my pharmacologist before getting any cream. I get my cream directly from them. I actually get a prescription of sesame oil at this time.
Skin cancer research reveals that anyone, regardless of the skin color, can develop skin cancer of various types. And this can occur with errors from the mutations of the DNA skin cells. This will further cause the cells to grow out of control.
Risk factor for skin cancer will have exposure to ultraviolet radiation, previous history of skin cancer, family history of skin cancer, precancerous lesion. There are people that were born with some lesion on their skin. History of exposure to radiation. Maybe patient has cancer of the breast or maybe cancer of the head and neck. He can be prone to skin cancer in future because the skin is part of the organ that has been radiated. So most cancer begin with benign lesions. Patients have those kind of lesions in their system and notice that the lesions are increasing in size. They are prone to cancer of the skin in future. Prolonged history of burns. Maybe a child was burned at 5 years or 6 years. Chemicals like asbestos, chromium, weakened immune system. When I talk about weakened immune system, these are people that are on drugs, some antibiotic, HIV patient, because the immune system is low, they are prone to skin cancer.
Although some level of sunlight is good, talking about vitamin D, suspicious changes help detect skin care at its earliest stages. Early detection of skin cancer gives one the greatest chance for a successful skin treatment. To this end, make an appointment with your doctor as soon as you notice any changes on the skin that are unusual. Take note, not all skin changes are caused by skin cancer. Allow a medical professional to do a thorough investigation to determine what exactly has caused the change. Thank you, Magdalene. Our skin and getting it to glow and shine doesn't have to be fair. You could be dark and glow. It's very important because people see your outward appearance before they get to know who you are. So how you look, it's important, I tell you. Now we have another doctor with us. He's been here before, I think sometime in 2020. That tomorrow was 2020. It's great to have you here with us today, Dr. Douglas Emeka Oko. Did I get it right?
Very well,
Consultant
indeed.
neurosurgeon.
Thanks for having me, Thelma.
Great to have you with us. We'll chat. But first up, let's see what Charles Obike put together, talking about skin cancer in men.
No, I've not been to hospital to check any form of cancer disease. No.
Okay, why?
Actually, the work is so tedious. There is no time. Even when you think you have the time for weekend, that same time, one thing will bring you up to handle one issue or the other. So, actually, just time. Time is just a factor.
So have you ever gone to the hospital to check if you are developing any cancer issue?
Actually, I've never had that at the back of my mind. I've never gone, if I've gone to hospital, I've gone for one thing or the other. I've never particularly have time for cancer checks.
Okay, why? What was bringing you?
Well, see, as a typical African, some of this ailment that the moment you have knowledge, pre-knowledge of it, it degenerates into some kind of thinking, hypertension, and so many other things. So I would prefer not to even bother myself thinking about it. What about those ones that are even known? How much of them have we been able to tackle them? We're talking of COVID-19. They're talking about TB. They're talking about so many of them like that. We've not been able to address them. So talk more of going to discover another one that is already there hidden. So I don't really, but so that I can sleep and have sleep well.
No, I've never been to any hospital to check because of my job. It's not because of my job, but because I know my body. I'm okay. I'm strong. I'm healthy. So there's no time for. There's no need to go to do checkup because I know I'm strong. I'm okay.
Medical findings indicate that men are less likely to survive cancer. It is estimated that 1 in 2 men will be diagnosed with cancer during their lifetime. Some cancers affect men because they develop in male reproductive system. Men can help reduce their risk of having cancer by exercising, eating diet low in saturated fat, maintaining a healthy weight, and quitting smoking. Gender-related cancers in men can interfere with sexual and fertility functions. It is important that men discuss their cancer treatment with doctors.
Some somewhat believe that going to the hospital will make them worse. So they're scared to go and test. They're scared to go to the hospital. Going to the hospital will make you they will help you. The doctors will help you. But they're scared. We have what is called eye cancer. The eye cancer can affect anybody, whether you're a male or a female. Then this eye cancer is when the cell grows out of control. You cannot control it. In that case, it will affect the sight of the men or women, whoever that is involved. But it can be controlled when it is diagnosed very early. We have different stages in eye cancer. We have stage 1, we have stage 2, and we have stage 3. The stage 1, the cells does not spread to other parts of the eye because it is still very small. The stage 2 is the same thing. It has not spread, but the stage 3 is very critical. It can spread to other parts of the eye, including the body, which will lead to so many things. It can affect the brains. It can affect the optic nerves. Then it can affect the person's vision. I've treated a case of a man that got eye cancer. When the man came to my clinic, I notice because we optometrists, we can detect it through the signs and symptoms. The eyeball will be bulging out. The person will complain of blood vision. The vision will reduce automatically. Then the person will complain of pains inside the eyes or around the eyes. All those things, once you see the symptoms like that, you know that you don't need to think twice about it. You know that the person got eye.
Also be careful for that. Of course, they say your eyes are the window to your soul. It's also the outlet through which you can see everything that goes on in this world. So you need to keep your eyes in proper working condition. Of course, the eyes also mirror what's happening in your brain. So it helps you to understand, helps you to fathom, helps you to have foresight, and tells you to go see your medical professional as and at when due, which has become every now and again. You're watching Weekend Deal. We're talking about cancers. We talked about World Cancer Day, and we had that chat with Dr. Al Hassan, president of the Nigeria Cancer Society. We have another doctor with us, I told you earlier, Dr. Douglas Emeka Oko, the consultant neurosurgeon.
Hello, Nigerians.
Nice to have you with us. Ginger. Someone is reaching us from out of Abuja, from Plateau State, and it says ginger can be incorporated into our meals.
Well, basically, the key thing about primary prevention of any medical problem, be it cancer, be it infections, be it anything at all, we always talk about healthy living, isn't it? Healthy living in terms of the kind of food you eat, whether you do exercises and stuff like that. Ginger. Is ginger healthy? I'm sure it is.
Do you use it in your meals?
I'm not a nutritionist, but yeah, I'm sure there are things that actually eat that actually we spice with ginger and stuff like that. So I'm sure something like ginger actually has medicinal and healthy
implications for us
in it and stuff like that. But saying that ginger probably can be a main constituent for actually prevention of cancer, I think that's overstretching it a little bit.
Okay, thank you. That's good. We've talked about our environment too, that toxins are all around us. And oftentimes, many of us eat processed foods rather than having fresh foods and all that.
Yeah, but basically, if you talk about the things that will predispose or increase the risk of having things like cancers, of course, you talk about environmental factors, isn't it? I think Dr. Al Hassan Adamu talked about them. The smoke in the air, people having being secondary smokers when they are staying close to people who smoke, alcohol, the kind of additives and especially with canned food and all that. And that's why people always advise, eat natural organic stuff, isn't it? There are toxins everywhere. Everywhere.
We can't avoid them, but we can do the best we can in our own small space.
Thelma, absolutely.
Okay. There's much talk about underlying ailments. And in fact, the latest gist now is that some people, because they already have some diseases that they feel can predispose them to COVID-19, are not going for treatment, especially cancer patients, because it makes them more vulnerable to COVID-19.
True.
And if they do get COVID-19, it can be catastrophic.
True, very, very true. We all know that the COVID-19, in terms of when you look at significant morbidity, i.e. being very, very sick, or fatality, actually dying, that people who have coexisting morbidities or coexisting medical problems are at higher risk of these. Okay, but it's a balance, isn't it? It's a balance. People are afraid of going to hospital and all that because, they can contract COVID, or they're afraid that people might say, they have COVID, or some of the issues that are coming up with stigmatization from COVID and all that. But at the same time, still looking after yourself, still looking at primary prevention in terms of people having the knowledge. That's one thing I'm really passionate about. I'm really passionate about actually advocacy and health promotion and providing knowledge for Nigerians. Absolutely important. Okay, and people having the right attitude and the right behavior in terms of looking after themselves is extremely important.
What is the right attitude that we ought to have in terms
the right attitude, first of all, is that you should know that your body is like your door or your window. It will get worn at some point. important. Okay, so looking after yourself and trying to slow down that wear and tear process of the body and actually being proactive about your health is extremely important. This issue of God forbid, it won't happen to me. Nope, that's not the right attitude. The right attitude is being proactive, is being preemptive, and actually looking after yourself and actually seeking for information. I know what we're doing here now. We're really trying to put the information out there for Nigerians, but I'm saying, hey, Nigerians, be proactive about information. Look after yourself. This issue of going to do checkups every 6 months, every 1 year, it's absolutely important, Thelma. Extremely important. I know that generally, as the people, because of our very poor healthcare system and the poor healthcare indices and the significant problems in terms of the focus of all governments at all levels on healthcare, which is extremely important, that the issue of healthcare is not a mainstream issue in Nigeria.
Well, we're getting there.
Yeah, we'll continue to push, Thelma. We'll continue to push. So we are hoping that the more we continue to push, more Nigerians will understand that, hey, healthcare is important. And of course, one of the problems with healthcare is that it is not cheap at all. Healthcare is not cheap. And that's why this prevention thing that Dr. Al Hassan Adamu, who was here before me, talked about is extremely vital, extremely important, and something that we need to continue to push for.
Because treating any ailment at any time can be financially devastating.
Absolutely.
He also talked about access, availability, and affordability.
Yes,
three very integral A's.
The 3 A's. Yeah, I thought
This
about that again.
access, this access. People say they go to hospitals, they have to take card every time, they wait for 2-3 hours. Is that enough reason to deprive yourself of medical expertise?
Well, usually when people ask me questions like this, Thelma, the first question I ask them, I actually throw a question back to them and ask them, have you been to a public hospital before? What was your experience? You also your experience, your journey through the hospital. It is excruciating. It's really painful. You go here, the stress and all that. So imagine you having maybe some pain or weakness or any sort of symptom in your body, and you look at going into that sort of hospital, or you look at going to a pharmacy where you just go in, you pick a drug. I'm telling you, your default setting will be just go to the chemist. Okay, so access is extremely difficult, and like I said, I'll go back to what I said again. One of the major problems we've had for a very long time in Nigeria is that healthcare is not a mainstream socio-political issue. It is not. Okay, and
how can we make that thing easier, coming in and not being made to go 2 hours perambulating before you finally get access to the expert knowledge you desire?
You can only do that when all the key actors understand that healthcare is fundamental, and that we start pushing all the buttons to actually make sure that this thing that we call patient-centered care, where you actually look after the patients, where you actually think of the patient's journey at all levels. Be it at the facility level, be it at the Federal Ministry of Health, you actually think, hey, how can we actually do things in an innovative way, throwing technology and all that, to actually make life easier for people in terms of this access?
It is obvious to me that you don't work in a public hospital.
Well, I do not work in a public hospital.
Have you had a first-hand experience of working in one?
Yes.
Okay.
I trained in Nigeria before I went to the UK. I did my medical school. I actually worked in Nigeria before I left.
Okay, that's good. So that's how you can tell us about best practices.
Thelma, the Nigerian patients are worth it.
Thank you. That's brilliant. That's fantastic. It's inspiring. It's motivating. And also, it should make us do all we can to continue to imbibe great lifestyle practices.
Absolutely.
But we do hope, yes, partnerships are integral, especially for funding and to make access, availability, and affordability no longer an issue for many Nigerians. Just like our last conversation, this one has been so enlightening. You talk with so much inspiration, vigor, and vibrance. Thank you for coming today on Weekend Deal, Dr. Douglas Emeka Oko.
Thank you, Nigeria.
How am I sitting? Am I sitting well? To ensure my spine is okay?
Well, you're looking good now.
No, I didn't say look, sitting. I'm worried about my spine.
In terms of your sitting position.
Okay. Thank you, Dr. Oko.
Thank you so
Great
much.
to have you have this chat with us on Weekend Deal. Lifestyle of cancer therapy. Let's learn more.
Some cancer risk factors, such as genetics and environment, are out of your control. But research suggests that about 70% of your lifetime risk of cancer is within your power to change, including your diet, avoiding cigarettes, limiting alcohol, reaching a healthy weight, and getting regular exercise are all great steps for preventing cancer. What you eat and don't eat can also play a vital role.
So when you think about cancer and diet, there are a few key things that you have to consider. First is what causes cancer, right? And then the second thing is what kind of association really is there. And so let's touch on the first part first. So in terms of what causes cancer, there are a lot of things that can cause cancer. A lot of them are frankly unknown, but what is known is that genetic factors play a role. So these are things that are already in us. We're born with it. We might be predisposed to getting certain types of cancers. And then there is the environmental factor, which comes into play with things in the environment, things in the air, things that we consume, and these are termed carcinogens. And so some of sort of the more common carcinogens that maybe one might think of when you grill. So you might have heard when people are grilling, they say the charcoal, too much of that isn't good for you. So we know a lot about that now. And so in terms of other foods that are sort of associated with causing cancer, so not quite causing it, but associated with it, those include things like red meat, sugar, processed foods, so chemicals that are in processed foods. And so it's very important to minimize your exposure to those kinds of things.
While certain dietary habits can have a major influence on your risk for cancer, conversely, other dietary habits can lower your risk. Aim to build your diets around a variety of antioxidant-rich fruits and vegetables, nuts, beans, whole grains, and healthy fats. At the same time, try to limit the amount of processed and fried foods, unhealthy fats, sugars, and refined carbs you consume.
Really important things that we can personally do are to modify our diet and also increase in exercise. So those are things that have been shown to be associated with improving our body's natural immunity and also decreasing the chances of getting cancer. And so in terms of diet, some of these things are well known. Increasing your intake of vegetables is definitely high on the list. Fruits that are high in antioxidants that help really scavenge the body for stress radicals, things that are known to cause cancer. Decreasing your consumption of red meat, red and processed meat. Decreasing your intake of sugar, processed foods, that's really important. And other things that you can also do are adding more spices to your food as you cook. Things like turmeric, cumin, ginger and garlic have natural antibiotic properties and even cancer-fighting properties in the case of turmeric and cumin. And those are certain things that can really improve your body's natural immunity and also decrease cancer risk.
If you have a history of cancer in your family, making small changes to your diet and behaviors now can make a big difference to your long-term health. And if you have already been diagnosed with cancer, eating a nutritious diet can help support your mood and strengthen your body during this challenging time.
At any point you find yourself, eating healthy, nutritious meals is so critical. We know we have not told you everything there is to know about cancer, but we have gone far and wide. What is your lifestyle like? Are you eating healthy? Do you take time to work out? Drink lots of water? Have a positive mindset. Wish everyone well. Do great things. Plan for your future. This body is the only one we have in this lifetime. It's in our best healthy interest to treat it well and ensure that in the years to come, our body will work for us. Your health is your best wealth any day, anytime. It's always a pleasure to have you on our program, We Can Deal. Thank you for being a part of it today, as usual. Join us at midnight to be a part of this package. The repeat broadcast, we are also on YouTube. NTA series, NTA programs, go there and have a feel of what we brought forward for you. My name is Thelma Obaso. Have yourself a great week. Bye-bye.